So we're here to capture some stories, and part of that story is learning what is your story, what's your origin? How did you get yourself here?
That's a loaded question. That is a loaded question.
I actually kind of took a non-traditional path to medicine. I started off as a business and finance major,
Okay.
Just down the road at GW. Midway through college, kind of decided that I wanted to pivot careers. Being at Howard, it was really evident early on in my residency program. A big proportion of our patients have sickle cell, much higher proportion than you would see in other parts of the country. There's so many aspects to sickle cell that are very complex, and it's managing the whole patient itself and not just the disease.
I am currently at Howard University College of Medicine, currently a fourth year. So I was actually born here, but I grew up majority of my life back home in Nigeria. And then I got into medical school in 2019, and here I am, because initially I wanted to be a lawyer. So for me, for me at the back of my...
Thank you for not becoming a lawyer.
I don't think I would have been a good one. I really don't think so.
Looking back on it, it's one of the best decisions I made, and that's what kind of ultimately led me here to Howard and working with sickle cell patients. Just the type of patients that I get to work with have really made it rewarding on a whole different level.
That shift, it's not like a normal shift, what was it? I mean, was there some experience that you had?
Yeah, but I think ultimately I was looking for to kind of build a deeper connection with people, and medicine really allows you the avenue to kind of build that deeper connection that kind of goes beyond business and finance.
So this is fascinating, because we just met a medical student who was going to be a lawyer, and she shifted from the dark side into medicine. You were finance, so maybe there's some hope that people are reorienting themselves in the right way. I'm just making fun of it, but it's just fascinating.
I'm currently the Chief Medical Officer at Howard University. I've been practicing in the region for 23 years. My journey here is sort of a full circle journey. So I started in undergrad. I did my undergraduate training in microbiology. And then I went off to Nashville for medical school. 10 years into my career, you start to think about, okay, what's next? Once I learned that Howard University Hospital was moving towards a partnership with Adventist Healthcare, I decided to explore it, and before you know it, here I am. Full circle. One of the reasons I chose Meharry is that I had family there. And my cousin, who was 44 years old when he passed away from sickle cell, but I got to see firsthand how he dealt with it, the stigma associated with it, and the chronic pain he had to endure, and the psychological impact. I think I was in my second year of med school when he passed away, but that has affected me in a way that really helps me empathize and have a lens that I wouldn't have had otherwise had I not met him and got to see him.
Back home in Nigeria, the healthcare system is really poor back home. I've had extended family pass away from things like malaria, which are treatable, but because we don't have the resources, people end up passing away. I've always been someone that wanted to advocate for people that didn't have a voice. But then after having a loved one pass away, I was like, wait, maybe I can actually change into medicine and be an advocate for people in that way. I do want to do sickle cell research. I do want to, try and discover something that can help people, in general. I love being able to interact with people, hear their stories, hear where they're coming from, and be able to offer help how best I can. When I go into a patient's room, I don't just want to see the pathology, and I don't just want to focus on, how can I get the results? But I want to learn about the patient holistically. I want to know, okay, how is your family background? Your socioeconomic status is what's going on behind the scenes.
Have you ever done a house call?
I unfortunately haven't.
Going back to the roots of medicine is to take it out of the clinic.
Yes.
So what you experience in clinic is very much a controlled environment. But when somebody invites you into their home, it'll be infectious to you, because you'll see you will be able to do so much more because you see it.
Yes.
You feel it, right? And you know the impact of it. So one of the things that I had a challenge for the medical student is next time you see a sickle cell patient in clinic, ask them, hey, can I come to your house?
There it is, right?
Do a house call.
That's right.
I mean, in one visit.
What better way to...
I think, there's something there.
Yeah, absolutely. Right now, I want to contribute to the legacy of Howard. And lean on our legacy to drive change. Physicians reach out to me all the time that want to come back in a similar way that I did to contribute in patients.
And, I live right down the street. It's easy for me to get over here, anytime. I'll be honest, I'm allergic to clinic, so don't put me in a clinic.
We have Benadryl and steroids for you.
And you are finishing Howard and transitioning on to being an intern. Then that brings opportunities you're training here and what you can bring back home to Nigeria. You could have gone on to finance. If we had a clone of you and you were to do finance, well, that clone of you and where you would be financially, satisfaction, all of those things, you are making a sacrifice, and that's not insignificant, but the grander scheme of it is that is everything who you are, right? The impact is huge.
When you look across the country and what Howard has contributed, there's no place like it.
When we start to look at certain disease conditions, particularly sickle cell. Sickle cell disease, even when I was a medical student here with my research background, having that exposure to it, you got to really feel it. You got to feel the impact of it.
We see it, and I trained learning how to take care of sickle cell patients. All that comes with that, right? The social impact, the psychological impact on the patient, and the chronic pain that needs to be managed. And it's a horrible disease. It requires empathy on the deepest level to really be able to see through that person's lens and take care of them.
Yeah, I mean, the challenging part is that I can't imagine what they're going through. I really, if I'm being honest, it's very, difficult for kind of the common person to understand what living with sickle cell is like. There's so many challenges, and the chronic pain really affects everything. It affects every aspect of their life.
Yeah, I mean, if you're in pain, how can you work? How can you be a student? How can you be a dad, mom, or any of these things, right? Life is very complex, and it's unfortunate, but, trying to get medical care in this kind of a healthcare system is not, it's disproportionate. The barriers are the things that really trouble me as a physician. I may be good at being a physician, I think I'm okay, but if I'm not given the resources or the funding and those things to kind of be able to advance things, then, all you can do is sit back and watch and observe, and it's heartbreaking.
It is heartbreaking.
And we're going to show these things to people, and they let them decide. I'm not here to put judgment or anything. It is what it is, right? And we are in Washington, D.C. There's a little place down here with a little dome on top with people who supposedly serve the interests of the American people, we the people. And I would hope that people would just understand beyond just, anything other than just being humans on this planet, right? That we're all just trying to get through this, that just even a slight change makes all the difference in the world.
And if you happen to find any of this interesting, or more importantly, if you want to collaborate, check out the link below so that you can send us your comments, any stories you may have, anything, we're happy to entertain it. And this is really about us going on a journey together.